Well, good afternoon. I'm David Stockwell. I'm the Medical Center Director for VA Northern California Healthcare System, and I'm just really thankful for the veterans out there today that are able to join me for this Facebook Live chat. Now, I'm not the techie. We have our techie folks here in the room, so I hope it's going to work okay, and they let me know more than a half an hour in that people can actually hear me as we go through the conversation. But let me just start. You know, oftentimes when I meet with groups of veterans, I'm thanking you for your service to our country. I recognize that you put your lives in harm's way to defend our freedoms, that oftentimes was uncomfortable, maybe fearful, the unknown, and yet you were there for all of us. And so really this is an opportunity for us as VA healthcare workers. Now we're in a moment in this pandemic with COVID-19 where it's unknown. There's some risk. There's a lot of fear. And we're trying to stand in that gap and serve you who've served our country. So we thank you for your service. And I would just ask, as you're trying to interact with the VA, to recognize that some of those healthcare workers that have been helping you and are ongoing and continuing to help you are facing similar challenges, maybe not the same, but in that context. And so we'll go from there. I want to spend a fair amount of time hearing your questions, answering the concerns that you have. And so hopefully you know how to use Facebook better than I do, and you can type those questions in and they'll get them to me and to my team. I have with me here Dr. Bill Cahill. He's our Chief of Staff. That's the lead doctor. That's the fancy term for that at the VA. I have our Chief Nurse as well, our Associate Director for Patient Care Services, Catherine Bucher. And then our infectious disease physician, Dr. Maniar, is here joined us as well. And so together we're going to try and answer your questions and address some things with you. Let me just start by making a couple comments about things that are different or for you as a veteran to know about at VA Northern California. There have been a lot of changes in the last few weeks. So if you are coming to our VA healthcare system, you've noticed that there's a screening process. And somebody once told me veterans won't have any problem with that because they're used to standing in line. And we have screening that actually has 3 different screening levels to it, and everybody goes through the first level of screening. That's just some basic asking questions, trying to understand if people are coming in already with fever or flu-like symptoms, if they've had known exposure to a COVID-19 patient and the like. And so the primary screening everybody gets. If you answer any of those questions in the affirmative, then there's a secondary level screening where we're taking folks' temperature, we're making some clinical decision tree choices about whether or not it's we want to send you home to call your doctor and have a video appointment, whether or not you really do need to come in for healthcare that day, or whether you need to go to tertiary level screening where we might actually swab and test you for the COVID-19 virus. And the flu, yeah, it's actually a 2-for-1 kind of deal at the moment. And so I want to make sure people are aware that we've got the screening at all of our locations right now, and to expect that if you come to the VA. They give you a little colored wristband each day after you've successfully gone through the screening. So if you have multiple places you need to go across the campus, you've got to go, to the lab and to your appointment, and in theory to the pharmacy, then you only go through the screening once, even if they're in second buildings. You just show your wristband in that regard. So expect that there are some changes because of the screening. We've also tried to dramatically increase the amount of virtual care that we're providing. In fact, we would prefer that you actually call your healthcare team before you come to the VA, and if that visit can happen via the telephone, or they can convert it to a video visit, then that actually might be a better way to get your health care so that you can remain in our social distancing and away from crowds and traffic and away from putting yourself potentially at risk to be around other people as we're battling this pandemic. And so we are encouraging, we've actually converted this last week thousands of appointments that were formerly walk-in in person, where they're being done via the telephone or a video appointment. And so you'll notice that your healthcare team may be reaching out to you with that change, or you in fact could be reaching out to your healthcare team and making that change yourself. And so a significant shift to virtual or telephone care. I did want to let veterans across VA Northern California know that we're still open. We haven't closed down any of our locations across Northern California. And so if you need us, we're here for you.
And although we want people to stay at home and self-isolate and try and break some of this growth in the pandemic, if you need us and you need to get health care, we're still here for you, and we want to be here to provide that health care for you. So we're still here, we're still open. Routine care, I mentioned we're trying to convert a lot of that to virtual or telephone care. We're actually reviewing our future appointments right now, and we have a kind of a 3-pathway process for each future routine appointment that is occurring. And that is, if we can convert it to telephone or virtual care, we're going to do so. If it's determined that it's time sensitive, it's of urgent, emergent nature, or it's necessary, timely for your ongoing care, we're going to keep that appointment and we're still going to have you come to the VA. Or if it doesn't meet either one of those 2 criteria, it really isn't going to work with a virtual appointment, or it isn't time sensitive or emergent, we're actually rescheduling those appointments 90 days out into the future now. And so you may have an appointment that you thought was going to happen, that the VA is going to communicate with you. We're actually not going to do it right now while we're battling this pandemic and we're practicing social distancing, but we're going to move it to 90 days in the future. And so one of those 3 pathways will happen with every routine appointment that we're evaluating at VA Northern California. We've been encouraging veterans to call, and I do want to acknowledge that our telephone system has been a bit overwhelmed while we've been doing more remote care and less in-person care. And so today, patients that are calling into our scheduling line about their appointments and those types of questions, the queue is about 6 minutes. So when you call VA Northern California, if you picked up the phone right now, the average wait time before you talk to somebody, and whether that's the clerk or they connect you potentially to an advice nurse, that queue is 6 minutes long today. And so a number of veterans get frustrated waiting so long and have hung up the phone and may decide to come in person. We're trying to address the timeliness. We've actually gotten a little bit better in the last day or 2 as far as trying to reduce that time, but it has been a 6-minute queue, and so I wanted to make sure folks were aware of that. So those are a number of changes that you would note and expect to have happen. By the way, we do about 68,000 appointments a month. So that's how many veterans come into VA Northern California. And we're analyzing and reviewing. We did the first 2 weeks worth and moved about 15,000 appointments into either virtual or future care appointments. So about 50% of them at this point during our first go at it. So you should expect to be hearing more from us about your future routine care appointments. Folks are asking me, well, how bad is it at VA Northern California? How many veterans have been confirmed to have the COVID-19 virus? Is your healthcare system overwhelmed with either your employees being out or veterans contracting and being confirmed to have COVID-19? As of the moment of this video right now, we've had 9 confirmed veterans in our entire catchment area that have been confirmed COVID-19. All 9 of those are outpatients. None of them are in our hospital right now. None of them are in our nursing home down in Martinez. All 9 of them were screened as outpatients. Most of them were actually screened, either in their vehicle or never coming into even inside the facility, because our screening activities are actually done prior to entrance into one of the physical buildings that we've got. And so we've had 9 confirmed cases. They're all at home right now. None of them have been hospitalized. We have 1 employee across our whole system that's had confirmed COVID-19, and they're at home right now. And then we have what's called persons under investigation. And that's somebody that we're worried might have COVID-19. We've tested them, so we've done the swab, just like you would get for a flu test, where they swab inside your nose and send it to the lab. And we've got, as of the moment of this filming, 53 individuals that we were awaiting the results. So we've swabbed them. We're not sure whether they're going to be a positive or not, but we're awaiting the results. And so I wanted to make sure that folks were aware that was the scope of what's happened to date. We're preparing for more veterans that are going to come our way, that are going to need our care, that may require inpatient services at the VA. And so we're actively planning for how can we surge our inpatient capabilities, the numbers of patients that we can provide care to in that setting. How can we appropriately manage isolation of patients or negative pressure rooms where appropriate, and evaluating how can we meet the needs when folks are going to need us most as this pandemic continues to move forward. So I wanted to make sure I shared that with you. I know this is supposed to be interactive. I've already talked for about 10 minutes, so I'm going to stop there and see what questions have come up. And so, Will, I'm not sure if you've got questions for us or not.
Actually, we've got quite a few, Director.
Okay.
So the first one is, thanks. My question is as follows. My primary care provider did a telephone appointment with me about a week and a half ago. My symptoms have worsened as far as lungs filling up every night. Cough is still bad. It has been 4 weeks now. The antibiotics she sent to me took 10 days to get here, so I've been on them 6 days, no effect. She told me I could not come into McClellan because I am sick. What now? And I'll be glad to repeat that. That's a long question.
Yeah, I think we got the basic gist of that. I'm glad I have clinical folks here with me for a doctor question. So either Dr. Maniar or Dr. Cahill, do either one of you want to address this question?
So I would say, first things first, you might reach out to your doctor and make sure that they understand that the antibiotics don't seem to have taken any effect yet, because they may want to make some quick adjustments. And they would take some assessment of you over the phone. If you have concerns or they have concerns, then most likely you're going to have to come into one of our ED or urgent care areas to be evaluated, and we can evaluate you more thoroughly and make the correct decision at that point.
Okay. You know, while we're waiting, just before I take the next question, I see there's a bunch of them. I asked if our infectious disease specialist, Dr. Maniar, might just take a minute or so and speak directly to the folks that are on the call with us. So, Dr. Maniar, what if you now have the floor directly with our veteran population related to COVID-19? What would you like to say to them?
Sure. I know this is really a trying time for everybody. It's been interesting to, drive around the streets of Sacramento when there's hardly any traffic, and it's been a big life adjustment for everybody, not just patients, but employees as well. And so as an infectious disease doctor, I'm sort of one of the frontline people that has been helping our institution plan for how to deal with COVID-19. And I want to first start by saying that in the last couple weeks, I've had the chance to work with a whole bunch of medical staff and non-medical staff in this institution who I typically don't get to work with. And I've seen an immense amount of dedication and hard work among those staff, trying to keep both patients and staff safe. We're trying our best as physicians to use the scientific evidence the best we can to help keep employees and patients safe. But as you know, that evidence is changing very rapidly. And so you might notice some changes in the way the screening questions are asked when you enter our facility. One big change, obviously, is the fact that we've really tried to switch to video visits. And I know that is a point of consternation probably for patients. It's also sometimes tough as a doctor, because I like to sit across the table from my patients and look at them eye to eye. But it's really important that we try to employ social distancing as much as we can. And this is one major intervention that we can do to reduce the risk to patients in terms of getting exposed to COVID-19. There are a lot of questions undoubtedly about testing, and I think maybe we'll just take those as they come. But I think that's probably the bulk of what I wanted to say today.
Thank you.
And I'm going to get a little closer. They're having trouble hearing me. But the next question is, Dr. Maniar, like you said, about testing. And it's, what if I think I need to be tested? So we've received a handful of emails asking, what if someone just wants to be tested, or they feel they might need to be tested? How can they go about doing that, or what is the protocol for that?
Yeah, so there's obviously been a lot of discussion about testing. And because of some limitations with how many tests are out there and how quickly those tests are turned around, Many county health systems have developed a prioritization scheme that basically directs clinicians to test higher risk individuals. And there is certainly commercial testing available, but also those systems have largely been overwhelmed by requests for testing. And so, you know, we want to sort of distinguish between people who need testing based on perhaps the severity of their symptoms or the fact that they live in certain settings where they may be at risk of potentially exposing others, from those who have very mild symptoms and maybe could remain at home following their symptoms carefully, maybe interfacing with their primary care physicians or providers through video visits. And so, you know, I know that a lot of people want to get tested, but you know, testing is not as widely available as we would like it to be.
One of the things I'd like to say about that, so a lot of veterans have asked, and even some of the ones on the chat box here have said, hey, I want to get tested. And you have the possibility of getting tested when you come to the VA. We're doing this 100% screening, and if somebody at the first level screening gets sent to secondary screening, they've got a temperature, they make it to third level screening, then we're swabbing and testing. We've done about 160 or 70 tests where we've tested veterans through that criteria. And so it's possible to get tested here at VA Northern California. We have the capability of conducting the test. We're just rationing, as Dr. Maniar mentioned, the quantity of tests that we can do, the lab turnaround time, and frankly, the preferred way would be talk to your primary care provider, talk to your healthcare team. If they direct you to come in for testing, actually we can coordinate that beforehand. We've actually done a few times where you never even get out of your car and we're able to actually complete the testing without coming into the facility. And so testing's possible for everybody, but it is not at will. I want to get tested, so I'm going to. We're only testing those that meet certain criteria, risk, as she mentioned. So Dr. Kale, anything else you wanted to add about testing?
Yeah, I think the only other point I would make is while Dr. Maniar and I would very much like to have the total data on how many people in our area, how many of our veterans have been exposed to this virus, there's many of whom actually may not even realize that they've had it and have actually recovered totally from it. But we just can't do that now under these circumstances. So we're trying to make sure we test the right group of people. So again, if you were to be tested today, and then you went to the grocery store and you said, "Gee, somebody coughed while I was there. I want to be retested." You know, today's test wouldn't answer that question, and you wouldn't even get the answer to today's question for about 5 days. So it probably wouldn't be as helpful as you might like, or we might like.
Might I add one other thing? Sacramento County does have availability for some drive-through testing that went online this week, but that is not necessarily true of all counties. So I would invite you, if you're interested, primarily, again, the Sacramento County resource is really only available to people who are symptomatic, but you can look at your local health department and see if they offer any testing as well.
Will, what other questions do you have for us?
So just letting everyone know who is watching, I won't go into details. Even if you provide them on the comments, we'd prefer you not talk too specifically about your individual incidents, just because there's privacy issues. But having said that, we do have a question about somebody who is scheduled to get some work done with a doctor here, and they're now questioning whether they should actually come in and whether they should reschedule. So I think you've touched on this a little bit already, Director, but maybe talk about the process if there's a question on whether they need to reschedule or not, or if they had an appointment scheduled, what they might do to make sure they should come in or not.
Yeah, so we're evaluating the future routine appointments and elective procedures in week-long bites and reviewing what's coming up. And of course, a lot could change between now and next month or the month after that. And so we're not actually trying to cancel, 90 days, even though we're not scheduling, if it meets certain criteria, out for 90 days, we're not canceling all future appointments for the next 90 days because we don't know how it's going to play out. So the best advice might be wait for the healthcare system to reach out to you if we arrive at that moment in time where we're going to triage and determine, can this actually be a virtual visit? Might it be necessary for you to come in anyway, given your current healthcare conditions, or is it possible to reschedule? So I wouldn't encourage patients that they need to take it upon themselves to reschedule a future appointment, because we will be reaching out to them.
And as a patient, you can reach out to your team through the through our secure messaging system anyhow, to let your team know, hey, I don't think I need to come in. I'm concerned. I'm in a higher risk group to be out in public. I'm over 65, or I have these other conditions. I'd rather stay at home. That would be important for them to know, and you can send that by secure messaging. Separately, in preparation, if you're thinking about, gee, I'd rather do it by phone or by the video visit, you might want to take this opportunity to download the Veterans Video Connect app onto your phone or onto your computer, so that you could have that video visit. You'd already have that part arranged, so that we might be able to hold that visit with you by video, which I think is a richer experience than by phone, but not quite the same as face-to-face, as Dr. Monia pointed out.
Conversely, to be prepared, My Healthy Vet is also a modality where you can secure message your provider team and have some of that correspondence. And so not only downloading the video app, but potentially doing the My Healthy Vet download or authentication might be a good idea as well.
Good question here about suicide reduction. Good question even outside of the COVID response. But with respect to suicide reduction, what percentage of VA NorCal staff, from janitors and medical staff, have been trained on crisis identification? And if it's less than 100%, what is the timeline to reach 100%?
It's a great question. We have some mandatory training that all of our staff go through that help identify how to connect folks with the crisis line that's managed by the VA nationally, 24/7, 365. And so all of our staff get educated on how to do some of that general identification and connection in that regard. I will just say that we're taking special cautious review when we mention routine care and evaluating the future, that patients that may have already been at risk for suicide or may, because of some of the financial hardships or anxiety or fear over the pandemic, are entering into potentially a danger zone, that our mental health team is very seriously reviewing all of those appointments. And again, as appropriate, we're keeping appointments that are urgent or emergent for veterans. And so a great question. We actually try to prepare all of our staff at some level. Obviously, we have professionals that are more thoroughly trained in crisis intervention and prevention, but all of our staff receive the basic understanding of what to look for and how to connect them to services to help.
I have a question here about personal protective equipment. Does VA NorCal have all the necessary personal protective equipment needed? I'm reading stories about non-VA hospitals where staff are using garbage bags as protection and limited to use 2 masks per day.
Yeah, so it's a great question. Actually, one of the fears, and as you accurately are reading online and stories everywhere, that the safeguarding and the quantity of personal protective equipment is of concern. We're not out of any PPE that's required to appropriately protect our staff and our patients that are interacting with us at this moment in time. But we have some pretty short supplies. So we're trying to get creative with our supply chain and looking for new ways to resupply the shelves, so to speak. Nationally, the VA is working on some pretty large purchases. The emergency management teams are looking about how to help us in that regard. We're doing a couple of creative things right now, although we haven't deployed any of them yet. We're just reviewing our options. And some of that is we started producing some face shields. So in case we run out, we'll still have them available for our staff. We are starting today, just like some of you may have made homemade hand sanitizer. Although we have not had to use it yet, we're still using the commercial products right now, but we are actually making our own in case it might come to that in the future. And so I appreciate the question. Many people have said, can we help? Can we, we have some PPE, would you like it? And we've actually had some creative donations even from some unexpected sources that have been augmenting our PPE. The scarce resources, the surgical masks, the N95 masks, gloves, gowns. So somebody mentioned using garbage bags. That thought has crossed our mind if if things get worse, that we may have to get very creative. But at this moment, we still have adequate supply of gowns to be able to meet the needs. Some of the face protection, I mentioned the shields, the hand sanitizer, the CAVI wipes. And so we're monitoring on a recurring basis. We're communicating through our supply chain and trying to safeguard the supplies that we have. So one of the things that's most important, hopefully to share, is that we want to use the PPE, that's personal protective equipment, where it's needed for our staff and for our patients. And so if folks are using it indiscriminately or where it isn't required by the CDC, then we might be wasting, and then we could get in trouble later. So we're trying to protect those supplies. We're trying to prevent them from pilferage. We've had a number of scenarios where our limited supplies have walked out of our medical centers, and so we're trying to safeguard them a little bit more, but we have enough at this moment in time to meet the needs as they exist today.
So I would just want to add one other point on that. So you may have been impacted by a cancellation of your elective surgical procedure, or you're wondering why I'm not being asked to come in when I had planned to come in for some care. This is part of that effort, and quite frankly, by decreasing the number of elective procedures, we've been able to decrease how fast we use up our supply of this personal protective equipment, and also keeps our beds ready for veterans that were really going to need it. And we're just repeatedly in planning meetings trying to figure out how we can stay ahead of this so that we can be there when our veterans need us.
Could someone please speak about the long-term care or nursing home in common wording? What kind of effect this has had on the nursing home care, the long-term care?
Yep, so there's a lot of different names for a nursing home. We call them community living centers in the VA, or CLCs. And the one that we've got down in Martinez, the 120-bed unit, we call the CREC, the Center for Rehabilitation and Extended Care. But in common language, that's a nursing home. And obviously, elderly or immunocompromised folks are at higher risk, has been identified with the COVID-19 virus. So a couple things we've done at our CLC. We've restricted visitors. So unless somebody's coming in with a end-of-life type of visit, there's no visitors permitted at our community living center. We're doing a very aggressive screening of our staff in and out. We've stopped all admissions from community hospitals without the express agreement from our chief of staff for a patient that was in our nursing home, has gone out to the hospital and needs to return. And so we've had a few of those where we have, with appropriate isolation, actually brought them back into the nursing home. But we're safeguarding the patients that are there. We have no active COVID-19 patients in our CLC, so limiting access, limiting which staff are in or out, and limiting the admissions. We've also stopped all respite admissions. So if you were thinking, I'm scheduled for a respite admission to the CLC in the upcoming next few weeks, that is not going to happen, because we've stopped all community admissions to the CLC to protect those vulnerable patients that are there in our care right now. Anything else to add about the CLC?
No, I think that that the CLC actually has had a more robust and vigorous set of expectations placed on it because of the vulnerability of the situations we've seen in other cities like Seattle, and because of the nature of the population that tends to live in that site for longer than most of our patients do in our acute care area. The visitor policy identified in our community living center is about to be extended more explicitly here at acute care as well, where we have put policies together for those patients who might be ruling out as possibly having COVID, or who and are under droplet or isolation precautions. In order to protect the public, in order to protect patients, we're starting to ask that our other patients who are in admitted services limit the amount of visitor traffic that is going into our acute care and inpatient wards as well. CLC has led the way in helping us recognize just how serious we have to be about some of the kinds of conditions we've taken for granted, like the ability for our loved ones to be able to visit us when we're in inpatient care.
So the next question is about our partnership with the DoD. This individual says they're near Travis Air Force Base. Does the VA and DoD still have an agreement so I could go to the ER if, God forbid, I get symptoms?
So yes, we still have an active sharing agreement between David Grant Medical Center on Travis Air Force Base and VA Northern California. We still have our staff that are embedded and working alongside their active duty colleagues in a number of joint ventures there. However, David Grant Medical Center, similarly to the comments I made about routine care at VA Northern California, they've also stopped all routine care and all elective surgical procedures and outpatient procedures at their medical center. And so, although the ER is still open and under the right criteria, it's certainly still available for somebody that needs that level of care. Yes, you can use the ER at Travis. However, the routine care, very similar, and I hadn't discussed our stoppage of elective procedures. David Grant actually has done that as well. And so rescheduling, evaluating for the future, and hearing about how that's going to play out is another reality for Northern California veterans.
Next questions were regarding Tri-West, and they're asking have referrals to Tri-West been canceled?
Yeah, it's a great question. So care in the community, that's what we call our partnership of buying care. So whoever asked the question knows that Tri-West is the partner that creates a network of vendors in the community where we might refer patients to. They've also stopped all routine referrals to community care. So urgent and emergent cases are being evaluated by our healthcare team. A number of commercial providers have said, we're not taking patients anymore, we're closing down, we're not doing routine care, we're not doing elective procedures. And so we have about 6,000 future appointments or consults that have been requested in the community, and we're actually going through the process of evaluating all 6,000 of them to determine what are the next steps. So we're not referring any routine care out to care in the community at this moment in time. We're evaluating the care that was already sent out, and that's the 6,000 that we're working through. And then we're determining whether some of that care might actually come back and actually happen inside the VA if there's a time sensitivity, what a portion of that care could actually be delayed until after the pandemic is over, and which care we still need to find an appropriate vendor in the community. So it's again kind of a three-way pathway for what might happen with your referral out into the community. But there are significant changes. So that's a great question. I'm glad you asked it.
So this next question is about follow-up question to the personal protective equipment. Have you considered reaching out to Governor Newsom to connect to the state's supply chain staff? The staff was able to bring in 24 million masks to the state because they felt DC was not being proactive.
So we have the VAs coordinated by networks that have the different hospitals. So VA Northern California is one of 7 hospitals in our network, and we've been instructed to use our region in some of these negotiations, whether it be with FEMA directly and distributions or state and local governments. There's been a lot of discussion about the VA's role with potentially surge providing care to non-veterans if the community gets overwhelmed, and how to distribute those supplies. Some are controlled by HHS, some are controlled by FEMA and emergency management, the government. We did have some supplies that came our way from last summer's forest fires that were available for some additional masks. And so we are trying to partner with other sources. It's a great question. It's not being done at the local hospital level because we've been exclusively asked, let's help this coordination happen at some higher levels. And so our network office is doing the negotiation with states and federal potential storehouses for scarce medical supplies. So it's a good question.
Next question is regarding research, wanting to know how our research studies are playing a role in our response to the COVID-19 pandemic.
Yeah, so there's a couple of questions really about research and potentially there, and I better let Dr. Cahill speak here on some of them. But the short answer, if you're in a human studies trial and they're going to do that 3-part evaluation of whether it's really necessary for you to come in, a lot of times research is discovery. Some of it is clinical and time sensitive, and so that evaluation of is it urgent, emergent, do you need to continue, or can it actually be postponed? That's true for our clinical research as well. But Dr. Cahill, what would you like to add about research?
Yeah, so the second piece, I guess, is related to is the VA doing research, taking part in the research, and there's a lot of effort to be involved in research on how we can test for this virus more quickly, as well as different therapeutic trials that are being considered. One of the first drugs that became available for research trials, there was so much demand for it that they quickly had to pull back. But the VA as a whole is trying to take part in that. Our facility, as an individual facility, does have researchers that are involved in different aspects of how we can either evaluate patients or how we can treat them.
Next question, just asking about how our home care services have been impacted by the COVID-19 pandemic.
Another great question. One of the things that's unique to the VA is the volume of home care services that we do provide to veterans in their homes. And so thinking about sending our employees out or keeping patients isolated in their home that may have had exposure is really an important part of what we do. And so just like we have stopped routine care that isn't time sensitive or can't be converted to virtual, we're really doing the same thing with our home care services. And so only essential visits are ongoing at this moment. If they can be converted to telephone or video visits, we're actually exploring some new technology that might help us actually monitor some patients in their home to keep the social distancing. And so a dramatic reduction in visits from VA staff to the home. But again, we're still continuing if it's an essential visit. We have a hospital and home program that is still active that have 7 patients admitted to it today, and they're routinely going to those patients' home and providing care. So we're evaluating them, and there's a dramatic reduction in a number of those services. We've halted some things that are home-based, so the Caregivers support program where our coordination team that partners with a veteran caregiver in their home, so we've stopped doing those in-home evaluations and reviews. So only essential services from a home-based perspective are ongoing at this time.
We're also in the middle of setting up a program for both employees and patients who may be at home under quarantine for COVID to be monitored by our home telehealth nursing team using the technologies that we've traditionally used to monitor patients who have congestive heart failure or diabetes and need daily monitoring of those conditions. We're just converting some of that technology to be able to provide that daily service for those who are facing infection like COVID.
And I would just like to add that it's important to emphasize how much the VA has emphasized the ability to provide care where the veteran lives. We have much more capability than most healthcare systems to be able to do this. And this is very important to us on any condition, and even more important now. Having the hospital in the home, the home telehealth programs where we have transitions of care team to help coordinate when people are in the community or at home and make sure they get the right resources. We're about to launch another home health care coordination program. All these things are part of what we're going to be planning to use to care for our veterans.
Next question is about enrollment. It asks if are member services still processing enrollment applications, and would that be in person, or can applications be submitted in other ways, for example, through email?
Yeah, so well, we're still open for business. Our enrollment office hasn't closed, but Just like with other consultative advice for veterans, if you can do it remotely, we would prefer you actually do it remotely. And the ability to apply for VA care online has been in place for quite some time. And so you can do an online application for enrollment to the VA without having to come in person for that application. And so if it can be done remotely, we would encourage remote, but we have not closed the enrollment office. It still is open and accepting applications.
I'm not sure you touched on this earlier, sir, but there's a question about homeless veterans. What are we doing as far as reaching out to homeless veterans in the middle of the pandemic?
So a particularly challenging population where if you're isolated at home and you don't have a home, how does that play out? And so, Dr. Kale, would you like to touch on sort of our strategy for the homeless and how we're meeting their needs?
Well, we have had a pretty robust program for homeless to try and get them into shelters of various types. We also have PAC teams devoted strictly to patients that are homeless to give them the extra resources. Then it becomes a little bit trickier when they get really ill and we're concerned that they have COVID. We probably will have a much lower threshold to admit such a patient, because while they might send me home because I can take care of myself and I have a refrigerator that I can have to store medications in or whatever, and I have a family member that can check on me, a homeless person may not be able to do that, and we're also worried that our veteran may be a source of infection for other people in the same area, in the same shelter, for instance. So we might be a little bit more sensitive to admitting such a patient this time, at least until they've turned the corner on their symptoms and we've ruled out or ruled in the infection.
One of the things we're trying to partner with, some counties and some cities and other entities are evaluating what to do, not just with veteran homeless population, but with the homeless population at large. And are there potential options for those that have COVID-19 or are under investigation for COVID-19 to create some opportunities to isolate? And so we're trying to pay attention to those, exploring what future options we may have as well. So it's definitely on our radar screen. It's something that we're worried about, and we're trying to come up with some additional thoughts and plans moving forward. So it's a great question.
Next question is about getting refills on one's medication. This individual asks if they have a controlled substance medication, how can they be sure that our personnel are actually following up and making sure they get their refill?
Yeah, so another great question. It's interesting when there's a pandemic, some of the rules and requirements that are relaxed during critical times. And one of those is a requirement for a face-to-face appointment with a provider prior to a prescription for a controlled substance, where that can be done through a video visit rather than a face-to-face visit during the pandemic. And so they've relaxed some of those rules. Our pharmacy is still open, our clinics are still open, and we are exploring ways that we can limit the interaction. So even some of the pharmacy consultation, we're currently exploring whether or not some of that can be done via text message or remotely, so that folks aren't congregating for their consultative visit with the pharmacy actually physically here on the campus. So,
and we're also working on ways to limit those interactions when you're picking up the medication. So, as always, we've been trying to emphasize we can mail these medications to you. That would be the preferred way. If you have to come in to pick it up, we're looking at ways that basically you notify us ahead of time, we prepare it, we have it ready for you, and then we're figuring out what's the best way that whether we can deliver it to where you are, or have a set pickup so that you limit the time that you spend basically at risk of being exposed to other people that may have this infection.
Yeah, and as a follow-up to that, on Monday on our Facebook page, we posted detailed information as far as the different ways they can get mail refills for the prescription. So anyone listening, feel free just to scroll back to the Monday post and you'll be able to find detailed guidance on how to go about that.
Okay.
Next question has to do with testing. How do I connect with my primary care doctors I don't know how to set it up. There's a web page somewhere. How can I find out to go about this? So it sounds like they're trying to find ways they can actually connect with the primary care doctor.
So I'm not sure if the individual asking has a My Healthy Vet account, but you could certainly secure message your doctor. You could also call in, and although you may have to wait the 6 minutes in the queue when I mentioned the high telephone time, you can leave a question for your provider. They can send that through the computer to your healthcare team so they can reach back out. So your question might be, how do I download this new software so that I can have a video appointment? How do I tell my doctor I'm worried about something? And so call in or use secure messaging through My Healthy Vet are two good ways to try and get a hold of your primary care team.
This next question has a lot to do with testing and how they're paid for. I know we've touched quite a bit on testing already, but they're asking if there's a way to go through TriWest or Med7 or another agency and get a test, and I guess have us pay the bill if they are a veteran.
I don't believe so. The rules have been changing so much about covering, and even the federal stimulus package today has some wording in it that eminently might change who has to pay or if anybody has to pay for testing. So I don't know about the insurance companies. We're not referring the testing out. The only testing that the VA is partnering with are those where we're swabbing the patient as a patient under investigation, either in our inpatient unit or through the outpatient screening process. And we haven't issued an authorization for a community test anywhere else. So I'm not sure I understood the question entirely, but I think I did. And so the short answer is no, the VA isn't paying for those commercially provided tests in the community, but the options for a veteran where they may be able to get free testing is sort of an evolving process, and we're not sure what options may be available.
And again, you might want to check with your county public health department, because like for instance, Sacramento, you have to go through a little screening process itself, but if you answer the questions in a certain way, they will say, yes, you should come in, and they will give you a time, a basic time and a date and time appointment to be swabbed. So.
This next question's asking how veterans can actually contribute and how they can help. We have a lot of folks who are at home or stuck in their homes because of the social distancing for good reason, and they're asking how, as veterans, they can contribute and support our healthcare efforts.
There's 4 things that I really want to emphasize of what you can do as a veteran, how you can help, and others here may have some other things as we think about it. But the first one is, if you're able to stay home, stay home. So the whole idea, it's difficult. It's been a week or so or more for some of us where this isolation and requirement to stay home. But if you can remain separate, we want you to do that. And so we want to meet those needs in your home to the extent possible through the telephone or through some of the video technology. So 1, stay home. 2, make sure you are practicing social distancing, that you're washing your hands regularly to try and prevent transmission of the virus. Even when you're gathering together, veterans love to get together in groups, in halls, in posts, at the VA and congregate together. We've actually started to identify certain waiting room chairs that we're shutting off so that we'll force people to sit further apart than they otherwise normally would. And so practicing the social distancing and the good hygiene, I think, is really important as well. Number 3, and we've talked about this already, if we're going to be connecting with you through your email or through your video, then you can download and get yourself connected in that virtual world. So you may have been putting off, do I ever want to do a video appointment? I'm not sure. That makes me nervous, or I don't understand how email works in the computer, and so I don't want to do that. My Healthy Vet, I'm just going to continue to do everything I can face to face. Maybe if anything was going to sort of push you towards, I'm going to try and figure that stuff out. So try and figure out how VVC works. Try and make sure you have the secure messaging My Healthy Vet account established and set up so that you can take advantage of these remote modalities. And then finally, I mentioned earlier that veterans have learned long ago in their military career, how to stand in line. But it takes a little bit longer to get into the VA. people have different opinions about the quality of the screening and whether it makes a difference or whether this virus is a risk to them or others. And so there's a whole array of responses as people are coming in and being screened, where some folks are less friendly to those that are doing the screening, that are at each of these posts. And so I just want to ask the veteran community to partner with us. We're doing this to keep you safe, to keep our staff safe, and potentially to keep your loved ones and our loved ones safe. And so be compliant with the screening. Don't try and skip the line or again, if you relate to the person that's actually doing the screening, one of our employees that's asking every person coming into the entrance questions about potential exposure to COVID-19, they're putting themselves out there. And so I just want to ask just a plea to be kind. So other thoughts of what veterans can do?
I think it seems a little awkward that we're having this conference and we're talking to you and telling you should practice social distancing. And then we're all sitting here lumped together.
Right.
And that's purely the result of the camera. But the fact is, we do a lot more. We've had to change the way we work just to increase the space and to decrease the risk of spreading germs. But one real point I wanted to add, veterans should check on each other. That's one thing that you are very good at. Make sure you can do that by phone or by FaceTime or whatever. Check on each other. Make sure that each other has the things that they need.
I'd also like to add that this is a stressful time, whether you're at home or you're here with us. We are all balancing very complicated lives, and we recognize that having limits about where you can go and who's going to cut your hair and how are the groceries going to get here and what about that toilet paper business and all of the issues that we're facing when we're not in the workplace or out in the world feels compellingly difficult. Please do whatever you can to help you and your family and your friends stay even-keeled, find some fun in your day, maybe find something that's edifying, and if you are having a sense of anxiety that's beyond what is perhaps a level that you feel you can cope with, our mental health services are open for business. And so, Dr. Cahill, so we are anxious for you to reach to us rather than to try to go this alone at home.
I've got a last question here, and then we'll wrap up. We're almost at the hour mark. Someone's asking about they're having an appointment in the near future, and they're wondering how long it'll take to get in. So it's basically a question about how the screening process is prolonged the wait to actually get inside our facilities.
It's a great question. It depends on where you're going for your appointment. So we have 12 sites of care, and I'm not sure which location you're going to be going to. If it's here at the Sacramento Medical Center, I think we've got 11 primary screening stations, and so even at the beginning of the day when all the employees are coming in, it's really not, it's maybe a 60-second delay from what it otherwise has been. So you're not in a line with a large number of people. If you're required to go to secondary screening, it's going to take a little bit longer. And if you end up at tertiary screening, yet a little bit longer than that. And so it's hard to predict. If you are feeling well, you're confident you're going to pass the primary screening without those flu-like symptoms or direct contact with a confirmed case of COVID-19, a worsening cough, or been directed for testing. You can answer those 4 questions no, then you probably aren't going to need more than 1 minute of extra time to be able to get in and get to your appointment. Parking's a little easier because we've reduced the volume of appointments, and the volume once you're in is also lower. And so it might take an extra minute. If you've got to do the higher levels of screening, it may be a little bit longer than that.
I just want to end by saying I know a lot of the folks here will actually be seeing this after the fact, and so you might have some questions that arise. Feel free to email me directly, and I'll try to follow up those questions for you. And my email is william.martin, and that's MARTIN, the number 6, at va.gov. So that's william.martin6@va.gov, and I'll be glad to follow up with those questions. And we'll probably do this in the near future again. So feel free to share this as well after the fact, so as many of your veterans friends and others in the veteran community can see this. But any last comments from the folks on the panel?
I want to thank Dr. Maniar for taking time, especially unknown until about 10 minutes ago that we were going to put you on camera on Facebook Live, so thanks for coming. Dr. Bucher, also appreciate you didn't know this morning when you wore scrubs on your way into work today that we were going to put you on camera. Dr. Cahill, thank you for thoughtfully sharing with veterans and the questions they had. And let me just thank again the veterans that are partnering. You're helping to get the word out by participating in this. There are so many different sources of information. We thought it'd be worthwhile just to spend a few minutes talking to you, sharing directly with what's going on at the VA. So thank you for partnering with us and getting that word out. And be safe as we continue to battle this together. So thank you.